As we cover your health tonight, flu cases are at soaring levels right here in the hub city and all across Louisiana with no signs of peaking. Now, News 15's medical editor, Dr. John Lepre, tonight he breaks down the numbers and explains exactly how you can stop the spread.
Let's take a look at the trends for viral upper respiratory illness in our area. Nationally, Louisiana and South Carolina still lead the nation, and both are now at their highest level of activity. But as you can see, the southern states, including Mississippi, are right behind us. And activity is moving westward, now including New Mexico and Colorado. Locally, this pattern hasn't changed. Activity remains highest in the Lafayette area, as well as everything south of I-10 to New Orleans. Overall activity is up 11%, and we're seeing an increase in hospitalizations and mortality. Now let's take a look at the viral breakdown. Things are still favoring influenza, which is up 5%. RSV is up 3%, and the rest, including rhinovirus and COVID, remain about the same. Now let's take a look at the trending data in our area. I find this data really interesting. Influenza activity remains much higher than the previous 2 years. Currently, we're on a steady rise with no evidence of this activity peaking or decreasing. Now looking through January, 2021 peaks slightly over the next few weeks, then joins 2022 in a gradual downward trend. However, again this year we're just seeing a steady rise without a peak or downward trend. And the problem still appears to be influenza virus. Nationally, 78% of the influenza virus is type A H1N1. This is the one we hear so much about. This one will make you sicker. And at this point, I want to add it's one of the strains included in the flu vaccine, which remains very effective this year, and it's not too late to get your flu vaccine. So stay safe and stay with us for the latest. Wishing you better health, Dr. John Lepre, News 15.